I think, unfortunately, it's the politics that interferes. And what we need to do is keep coming back to the most important issue, which is that we don't have enough GPs, we don't have enough resources for actually 5-day weekday working, let alone for resources for out of hours and urgent care. Now, we've had lots of studies that have highlighted that urgent care and GP out of hours services needs more funding. We've had lots of publicity about that. When politicians and the media talk about patients going to A&E rather than their GP on a Sunday, they're not actually talking about patients going to have a diabetic check in A&E. They're talking about patients who've got coughs, who've got a chest infection, a child with earache, and all of those services actually are urgent care, GP out of hours services. So in fact, even politicians themselves are not being consistent with their own language, because if what they want is to avoid patients going to casualty, then they need to resource GP out of hours and urgent care services. It's not going to help if GPs aren't staffing urgent care services because they're instead sitting in empty surgeries on a Sunday. So this is about just using resources sensibly and defining 7 days as being exactly around ensuring that urgent care is provided 7 days a week. If the government is serious around weekend effect, if it seriously wants patients who are acutely ill to get a good service on a Saturday and Sunday, or for that matter at night, well, you can't do that if you take GPs away from acutely ill people to be sitting in a surgery to provide care for routine services when you don't have enough GPs available for acutely ill patients. If the government wants to move swathes of care out of hospitals in the community, patients who are acutely ill will be in homes, in their houses, rather than in hospital beds. That needs out-of-hours urgent care services to be available. I meet GPs now who have stopped doing out-of-hours shifts and instead are working in their Challenge Fund Access Hub. And therefore their out-of-hours service now has fewer GPs to attend to acutely ill people. I said in my conference speech, I think that's immoral. It's wrong that patients are denied GP services because the GP has been taken away from attending to acute needs. So if the government is talking about 7 days, about the weekends having responsive GP services for acutely ill patients, well then the way you do that is not by taking GPs away from out-of-hours services, which is what is currently happening.